Have you ever had this happen to you? You walk into your veterinarian to find out what's wrong with your dog Spot or your cat Freebie. Well, your veterinarian checks them out and says, I think it's blah, blah, blah that's wrong because of the symptoms you told me. And sure enough, a few days later, your pets are not getting any better. It's generally pretty hard to have an exact diagnosis for animals. You can't actually ask the pets what's wrong with them. So, in today's episode, Dr. Jyl Rubin, she joins me. And guess what? She may just have a solution to better diagnose your pets. There's a new testing protocol that actually tests your pets for more accurate diagnosis. You know, it's all about having more tools in your veterinary toolbox, and Jill's got a very big veterinary toolbox. She's going to tell us how testing works and some pretty crazy stories that go along with that. Her toolbox also includes ozone therapy. She's actually got her own company that specifically tailors it to animals, and a lot more. Her tools are many, and the best thing about it is she's going to tell us all about these veterinary tools that can probably really help you in the future when you may have some issues. Now sit back and get ready as Jyl takes us on a journey throughout her veterinary, get this one, workshop full of tools. And she's going to give us options that we probably will really need one day with our best friends.
For real, 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 for real. Got a bunch of furry friends and I love them all the same. I'm an animal lover, veterinarian is the name. Let's share some pet stories from heartwarming to strange, losses and gains, from wacky to insane. For real. You're now tuned in to For Real with your host, Mark Kyle.
Hey, everybody, and welcome back to the For Real podcast. Today, I'm so excited to have a friend of mine as well, Dr. Jyl Rubin, join me, and she's got all kinds of interesting options that you may have to treat your animal, and I can't wait to get in. Jyl, welcome to the show. I'm really glad to have you.
Hi, good morning, Mark. How's it going? Happy to be here.
Oh, I'm really happy to have you here because we're going to cover some stuff, like we always talk, different tools in the veterinary toolbox that as a pet owner, you may not know about. And it's certainly a direction that people can go in. But what I thought we would do, let's go into your background, how you got into veterinary medicine and kind of move forward. And then we'll start talking about all these different things. That sound good?
Sure.
So were you one of those people that always wanted to be a vet when you were growing up, or did you do it later? How'd that work?
Yes, my earliest memory is when I was about 4, which is a very long time ago now. But I remember my parents actually rescued a German Shepherd when I was a little tyke. And I mean, this back in the 60s, right? If that gives you an idea of my age,
Right.
Which, nobody did that back then. Who rescued dogs back in the 60s? It was pretty rare.
Right.
But my mother was a huge animal lover. She grew up with animals. And so her love of animals trickled down. And she rescued this big, giant German Shepherd that was beaten with a garden hose. His name was Ranger.
Oh.
And he was this massive, big guy, but he had a really nasty streak in him. And my parents loved him. And of course, it was, I loved him. He was great with us. But, a couple times chasing the mailman out to his truck and biting my uncle. And he was a little bit of a headache, So,
Right.
but I remember my earliest memories literally sitting on his back and pretending to sew his ears. Like suture his ears at 4. That's my first memory of thinking anything to do with veterinary medicine. Yeah, isn't that crazy? It's just one of my earliest memories. So, and of course, sitting out in the backyard singing to the birds, thinking I could talk to the animals, and a lot of signs, But as I got older, I kind of dropped the ball a little bit, and I was actually an English major. At first, I thought I wanted to be an English teacher, but I just was unsettled. I just couldn't figure out, why I was so unsettled. I went into theater arts, believe it or not. I did that too. I went into cosmetology. I tried all kinds of things. And then I dated a guy who was a manager of a thoroughbred breeding farm. And I went to visit him. He lived up in Santa Ynez. And I couldn't get enough. That was it. The horses were beautiful. And I remember coming home to my mom and saying, this is it. I don't care if I have to pick up poop the rest of my life. I want to work with animals. This is what I want to do.
Oh, that's cool.
Yeah. So changed my major and went to the counselor, and the counselor says, I don't think you're smart enough to be a veterinarian. I don't think you're I don't think you could do that. You're in a English field. You don't have any sciences or anything, and I got out of college. I got out of high school early. So I was a little ahead of the game anyway. I had already had a 2-year liberal arts degree, and I was 19 at the time. And so I trotted over to the animal agricultural side of campus down in LA at the time. And I talked to one of the people I still talk to. This is almost 50 years later now,
Wow.
45 years later, and he kind of pointed me in the direction of going into animal health technology, which that's what it was called back then, or AHTs, which are like veterinary nurses, right?
Right.
And so I was fascinated, but I struggled because I couldn't figure out. These classes were all in science, and I remember going into this horse science class, going, whoa, this is so cool. You could actually count teeth in animals. I just remember all these
Yeah.
crazy things, and I was just fascinated. And I wish I knew the name of that counselor now, because shame on him for
Well, of course.
trying to discourage me. But, it just kept pulling and pulling at me. I went through vet tech school. I did great. I was a straight A student in there. And I was a vet tech for 13 years before I went to veterinary school. I put myself through veterinary school myself, worked really, really, really hard. And, that dream kept pulling at me, and I wasn't going to give up.
So when you say San Ynez, are you from down like Santa Barbara area, or are you from that part of the world, or LA, or?
Yeah, I grew up in Los Angeles in the San Fernando Valley. Oh my God, I'm a Valley girl. But the Santa Ynez was about 90 miles from me. So I used to truck up there every weekend and shovel horse poop. And then I started to learn to ride. It was a thoroughbred farm, and I was pretty small. I thought I wanted to be a jockey. That's the first thing I thought I wanted to be, which, of course, is very difficult for girls, and as a tiny little thing. But had a lot of injuries and learned to ride and took horse classes. And I thought I wanted to be a horse veterinarian. That's really where I was going with that. And ironically, it's pretty much the only animal that I don't really do a lot of treatment on now. But yeah, it just kept working and plugging away. Got a job with a large animal vet assisting, and then on the mornings where I didn't drive up to San Ynez, I would work as a receptionist at a veterinary hospital, and just worked my way up, kennel and reception and technician. And I've been through all the checkoff boxes for the field of veterinary medicine.
Did you spend any time at Alamo Pintado in that area there?
I do recall Alamo Pintado. That was one of the more famous, well
Yeah.
known ranches. Yeah, it was fabulous. It was really, back in the '80s when things were really starting to boom up there, and the notoriety was coming in. It was great. So yeah, I used to go. I remember getting pictures taken in the winner's circle, and I was really involved in all that. Um, and then off I went to college, so I kind of got whisked away from that area. But I love it. Yes, I grew up about 90 miles south from that area. Just beautiful.
Well, Doug Herzog was the vet. He's passed now,
Oh yes.
and he's an innovator in regenerative medicine, which I spent some time with him for the stem cell thing. But he was such a nice guy. His son runs it now.
I haven't heard that name in many, many, many years. Yes, he was.
Yeah, he was the guy. I mean,
Yep.
big time. All the celebrities brought their horses and all that kind of stuff.
Yep. I remember that.
So
Yeah.
let's move forward then. So you go to vet school, and then are you still in LA? Where do you go from there?
So I was in LA and working really, really hard. I was a veterinary technician. I landed a really good job with a veterinary orthopedic surgeon who was my mentor, and I became his traveling nurse for 8 years. I traveled with him. Fabulous guy. And he was hardcore, man. He was hard on me. I mean, if that guy got mad in surgery, he'd throw instruments. But you know what? I loved him. He was just awesome. He taught me so many things. And I'm still, to this day, I consider him like a father figure. He's unfortunately passed away. He was, ironically, he and his girlfriend and their dogs were hit by a drunk driver and killed when
Oh,
he retired. And the family actually gifted me all of his surgical tools, all of his books. So there's a big piece of him within my clinic, and I really owe a lot to him. He was such a wonderful influence on my career. I wish that I could remember all the tricks that he told me, because it was so many years ago. But I worked as a veterinary technician in the Valley for years, and then I developed this little house sitting business because the vets would refer me to animals that were in need, that were, a little higher maintenance if people wanted to go on vacation. So I developed this little critter sitter business. And then I tried to get into vet school, and back then women weren't really as accepted
Right.
into vet school, and so it was really, really tough. I applied 4 years in a row. I couldn't get in. I was getting really discouraged. And then I was an avid scuba diver. That's one of my favorite hobbies. And so I got this brochure in the mail from a school called Ross University
Yeah.
St. Kitts, right?
Yeah. I know a lot of people.
Yeah, and on the brochure, here's this beautiful picture of this ocean. I mean, it was a great brochure. And I was like, oh my gosh, I could go to vet school and scuba dive in the afternoon. I was
That's
thinking, this is
cool.
so cool, right? Well, little did I know at the time, it was a third world country, right? It was a down, really down there, and no communication. And again, this is 1980, 89, right? Well, I got accepted, and off I went to Ross University, and I was there about 2 months, and Hurricane Hugo hit and detonated the island.
Oh,
And I got sick, and a lot of my classmates stayed. I actually bartered my way out of that country. It was a mess. Came back to the States. Uh, Went back to work for my mentor, who had done a residency at University of Tennessee, and said, "You know what? Don't You're not going back there." I actually went back to work for him. I passed out in surgery. I was so sickly. I actually had a bad case of Giardia, and lost a bunch of weight. He says, "Go to Tennessee. Go apply for a job to Tennessee. I know everybody there. They'll see what a hard worker you are, and maybe you'll get into vet school if they notice you." So, okay, so off I went. I applied for a job there, and I got a job interview. So I, from California, flew to Tennessee, and the day I flew there, the dean was shot and killed in his driveway. So
wow.
it was a mess. I know it was a mess. All my job interviews got pushed off, and so on and so on. But long story short, I got the job, packed my bags from California, drove across country with my dad and my tortoise, and took the job at University of Tennessee for a year. I was in the intensive care ward, running the intensive care ward. And ironically, it was the year that the veterinary school was a 3-year school back then. It was switching from a 3 to a 4-year school. So the year I was there, they didn't have a senior class. So I kind of lucked out because I got to be the senior vet student running the ICU ward. I didn't have very many students. And I worked real hard. They gave me the cruddiest hours. They gave me, the graveyard shift, and they knew I was hungry to get in.
Right.
But right across the hall from me was the exotics ward, and they didn't have a lot of money to spare. But I used to go over there and say, "Hey, I'm here at night. I'm doing graveyard. If you need me to check on any of those cool animals while I'm here, let me know." Well, sure enough, of course, they couldn't, they were thrilled with that. And so I got to work with some of the coolest animals, red pandas and eagles, and take care of them at night when everything was closed down. I was like literally the only employee in this big university other than the emergency staff, and did emergency care, and then applied to vet school again. And I didn't get in. And I was like, what the heck is going on? So I went and saw the dean. The dean says, Jyl, we're right between a 3 and a 4-year school. We really need you another year. And I said, look, man, I'm going to be 30 years old. I really want to go to vet school. I don't want to be a technician. I want to be a veterinarian. And one of the residents said, this is crazy. He says, look, I know everybody on the admissions committee at Tuskegee University. I want you to get in your car. Here's a piece of paper with everybody's name. I want you to go down there and tell them I sent you, and shake hands with them. I said, you're crazy. I'm never going to get in. He says, just go do it. So I did. Hopped in the car to Alabama, 6-hour drive with one of my friends, and did exactly what he told me. And guess what? I got in.
You know what that is? The old saying, if at first you don't succeed, try again.
Oh man, I was determined. There was
Yeah.
nothing else I felt in my heart I would do. And I did a lot of things. I actually was a professional clown for a while. I danced professionally in a pantomime troupe. I mean, I did all kinds of crazy things. I was a Mariner Sea Scout, but there was nothing that was going to stop me. I didn't care if it took me 20 years to get in. And that's a message for youngsters who really struggle to get into vet school, because it's really tough.
Right.
But don't be discouraged. Find a way. Do whatever you have to do, whether it's going for higher education to make your application look more presentable. But I tell that to applicants all the time. Don't be discouraged if it's something you really want to do, because Mark, I really believe what you do every day in your life, that's the secret to success if you love it, right?
Right. Passion.
Passion. It's not about the money. The money comes. It really does when you're passionate about something.
Right.
And so I think there's so many, life is so hard now, and there's so many crazy things going on. But if you can find something you're actually true to yourself and passionate about, that's what keeps you going. Because I have colleagues that are like, how the heck, I'm 30 years into being a veterinarian now. How the heck are you still so motivated? What is that? And we're so burnt out. And I'm like, I love it. I love it every day. There's something new every day, an animal every day. I couldn't imagine doing anything else. It's really fit for me as a person and as a career. So message to youngsters, follow your dream.
Yeah, absolutely. One of the things I'm concerned about for younger vets now, with all the consolidation that's going on in vet clinics,
Yeah.
they're really under, the corporation guidelines of what they're able to do. So they don't get to do what you've been able to do through your career. That's the hard part.
Right. I've seen that. Yeah, I've been visiting veterinary. I've been on the lecture circuit, visiting veterinary schools, and it's amazing to me how they're teaching these kids now with dummy models. I mean, obviously, it's great that we're not sacrificing animals,
Right.
but there's nothing truer than real tissue under your hands. And so I think some of the shelters have allowed them to come in and do the spay neuters. But what about those splenectomies? What about those broken bones? They're now trying to refer to surgeons, and I feel like when I went to veterinary school, I was exposed to everything. I mean, there was a horse, it was a kangaroo, it was a duck, it was whatever. And you better know the anatomy of that animal and at least know something to either triage it to somebody who knew something more. And nowadays, you don't get that. You get, I'm a dog cat vet, I'm an exotic vet, I'm a surgeon,
Yeah.
and I think we're doing ourselves a little bit of a disservice because there's such a gross shortage of these specialty people. I think there's got to be some other solution to the problem. Just trying to get a simple ultrasound from some of my patients now, I have to wait weeks. That's crazy. You can't wait weeks when you have a sick animal.
The other thing I found, which was shocking to me when I started working in the vet world, was I would always thought that the newer vets coming out of school would be more willing to look at new technology and that. And it's really not the case. It's the complete opposite. The guys that have been around for a while and done all these different things, they're more willing to look at alternative ways of treating. Because if they, I guess the philosophy, if I wasn't taught that in school, I'm not going to do that now, which I think it was complete opposite what I thought it would be. And I'm sure you're very familiar with that. But anyway, so we're digressing, so as I always do. So anyway, so then you get out of school. Where do you end up practicing as a vet? And let's get forward to today.
Graduated in 1995. I applied to the match program to do an internship because I thought I wanted to follow in my mentor's footsteps and become a veterinary surgeon, if you could believe that, which is the furthest thing from what I do now. So I ended up, I graduated with honors, which the first year of vet school, I almost flunked out. I was so stressed out of my mind, but I really pulled my bootstraps up and figured it out and applied, got accepted to VCA, which is a big, giant West LA hospital, very prestigious internship with Todd Tams, who I don't think he's practicing anymore, but he was a GI specialist. And I knew him. I mean, everybody in the Valley knew me because I was a vet tech for so many years.
Right.
And he was so happy that I got accepted. But then, I went to go back then, I didn't go to school in California. And so I passed all my national boards. I didn't pass my California boards. So I had to say, I'm sorry, I can't accept the internship. There were 7 of us accepted. Only 3 people passed. They were really in a world of hurt. So he said, look, I don't do this for everybody, Jyl, but I'm going to offer you the vet tech position here, tech for me for a year, and we'll hold your space. I said, Todd, I've been a vet tech for 13 years. I want to be a vet now. I have bills to pay. So I flew up to Nevada. I took my boards there. I passed my boards, no problem. I applied for jobs. I got 8 job offers, and off I went to Las Vegas to work. So
Did you ever work with Dennis Arn in Vegas?
NSR.
Dennis Arn, ARN.
Oh, Dennis Arn. Yes. I know of Dennis. I didn't work with him directly, but yes, I do know of him. I don't know if he's still practicing or not.
Well, he is sort of. He's around. He's a good friend. I've got to know him through the stem cell world, but he was with Desert, what is it, Desert Inn or whatever it is?
Yeah.
Yeah.
Yep. So I was there. I worked for a year with a independent guy who actually sold the VCA. He was pretty hardcore. I was so poor. I put myself through school. I had no car. I walked to work, and I worked really, really hard the first year. I ended up getting real sick, leaving and taking some time off, and then came back and worked for an independent hospital. Actually worked for PetSmart. 2 hospitals were built, were actually bought out back then. One was VCA and one was PetSmart, and I hated that model. I remember calling my mom, going, "Mom, I can't do this. I don't want to be a corporate veterinarian, and I'm going to quit." She says, "Are you kidding me? You can't. You've been through all this. You're not quitting."
Right.
I said, "Well, then I'm going to go out on my own." So I did. I put a Tupperware bin in the back of my car, and I started doing house calls. And I did a lot of exotic animal work. I learned a lot about exotic animals there. I sat on the board of a large cat rescue and a primate rescue, and I volunteered a lot. And I built the business. And then there was a guy, Gary Weddle. I don't know if you know him. He was around for a long time. He did a lot of large cat work, and he had a beautiful mobile unit. And I remember calling him and saying, "Can I come see your mobile unit?" He says, "You can come see it, but just know it's not for sale." I said, "Okay, no problem. I just want to take a look at it." Went and saw it, took a look at it. I was drooling. It was so exciting to see this cool veterinary hospital on wheels that
Right.
I could contain myself and do what I wanted and actually practice the way I wanted and not have to follow these corporate rules. And the next day he called me and he says, "You're the person I want to sell it to." So
You're kidding. That's funny.
no, nope. So he sold me the mobile unit at a really great deal. I took a loan out, I wrote a business plan, and away I went. I started doing house calls. I quit my PetSmart job and took my charts and left. And I started up there. And with the exotic animals there, it's really amazing. There was so many of them. I mean, you literally could go into a pet store and buy a baboon off the shelf, which is so wrong.
Oh my God.
But there were so many nutritional deficiencies, and I was getting so depressed about it. I thought, I got to do something bigger than this. And so I went and I tried to call on radio stations. Can I donate some time to make sure these people who are buying these animals know what they're doing? I couldn't find anybody to help me, but I had a client that worked for CBS in the television. And she says, "Why don't you do a TV show? Why don't you get on the news or something?" I said, "I can't be on TV. Here I am with a theater arts background. I can't be on TV. I don't want to memorize anything." She says, let's just go on for one afternoon and let's try it. Well, I'll tell you what, the phone lines were flooded
That's cool.
and it just progressed. Yeah, this is 25 years ago. Phone lines were flooded. I ended up getting a permanent spot on the morning news every Tuesday at one of the major, the CBS station, and became the veterinary news expert. It was all volunteer. I did it for years, and then I moved to California. I really wanted to come back to California.
Sure.
Gave up my internship and was commuting from California back and forth to Las Vegas in my big giant 24-foot mobile van, sleeping in the van, doing all my house calls, trying to build the business in California. Called the sister station here, and they picked me up. I worked with CBS for about 10 years. And then they dissolved all the guest programs. And a couple of years later, Fox called me and said, "Hey, you want to do this?" So I was with Fox for about 7 years. And since COVID, a lot of things have really slowed down. So I still do some TV stuff, but not very often, a couple times a year. And but in Vegas, I had my own TV show. I did that. I had a mobile vet show, which was cool by the government. So really into media and really spreading the word about um, good husbandry and of course my passion, holistic medicine.
Well, here we are on a podcast, the same thing. It's a different kind of media. And so, okay, so now you're basically in Northern California now. So you have your mobile vet there, but you're doing a bunch of other things. Let's talk about some of these technologies. And can we start with the test to treat thing we were talking about for people that are out there, some options they may have, and then get in some of the other things as well?
Yeah. So, gosh, there's so many eggs in my basket. And, through the years, don't, for the veterinarian that's out there, don't close the doors. There's so many things you can do, and learn more and more. I talk to veterinarians every day. I do a lot of consulting and helping other veterinarians. So test and treat, I want to bring that up because there's a fantastic laboratory called VDI Laboratories. And I've been so impressed with the gentleman that started this laboratory. Really, really great guy, biochemist by trade, has started this company where you can actually submit samples in it, and you send in the blood work or you send in the wells with the serum on them, and they do what's called test and treat, where they test the sample and then they give the veterinarian a guidelines on how to treat that particular issue, whether it's a vitamin deficiency or it's a GI disease. Excuse me. It's really fantastic. And through those panels, and I will just touch on, because I'm a microbiome nut. If
Sure.
you don't remember that, I'm
Yeah,
actually
well,
the
I know
ozone
that.
lady, the ozone lady, which is another story in of itself. I started an ozone company a couple years ago, just out of sheer passion because I was frustrated with the equipment. All the ozone equipment for animals was for people.
Right.
And I went to 3 ozone companies and I begged them. I said, please, let's start making this equipment for animals. It's ergonomically incorrect. The settings are incorrect. And none of them really wanted to work with me. And so I stepped off the cliff and said, I'm hiring an engineer. Little did I know how much work it was, but hired an engineer, redesigned all the equipment for animals, all the settings. And here I am. I have Regena's own vet now. I have a veterinary ozone company. It's been a real fun ride. We make all sorts of ozone equipment specific for animals. Everything's been retrofitted for them, all the settings. So it makes it easy for the veterinarian to actually, I always say I want to make it so easy a monkey can do it. And that's pretty much how our equipment runs. But the ozone has been a huge, huge addition to my practice and to many other practices. But this test and treat.
Yeah, I want to get back to it because, especially for the pet owners, that they can ask their vet to do this, because you told me some great stories about that. So let's get into that a little bit. So if I'm a pet owner, I mean, let's stay on your same train of thought, but I want people to understand what they could ask for to maybe find something to get properly diagnosed.
Right. And that's, just an example, right? When you have a culture, say you go into your veterinarian and you have a skin problem, the veterinarian's going to want to culture it, send it off to one of the major laboratories. They do a skin swab on the bacteria or whatever the organism is on the skin. They send it in. Those tests only check for really about 12 to 15 different organisms. And it's very limited because it only checks for bacteria. It doesn't really check for funguses or molds or things of that nature. Whereas this laboratory, excuse me, it's really interesting. It checks for all of those things: molds, bacteria, viruses. And what it will do is it will give you, for example, I've sent in a couple of different tests, well, more than a couple, but it will give you a different perspective on exactly what the results are. So, for example, when you get that test back, it will tell you all the bacteria, it'll tell you the viruses, it'll tell you the commensal organisms if they're positive or negative, meaning if there's an overgrowth, and it will tell you exactly what the organisms are, what antibiotics are sensitive to those organisms if the veterinarian chooses to use antibiotics. Of course, I'm not a big antibiotic fan. If I can avoid it doing it, without it, I'll use ozone or fecal transplants. But what's interesting is it's actually they use DNA sequencing instead of culturing it on a plate. And so it's an interesting way to go. It does a complete bacterial and fungal quantification, and it does a whole list of potential clinical relevant species. So it'll give you percentages of how many species are on that sample, or you could you could do it even in the GI tract. You could run the test little swab in the tushy, which is great because then we know what's going on GI wise. It'll test for antibiotic resistance in that specific animal for the relevant species, and it'll give you a table of the common antibiotics. But it, excuse me, it'll also give you like the bacterial richness score and the evenness score. And then it will give you, it actually gives you a DNA test of what that particular animal is resistant to, what antibiotics it's resistant to.
Oh, wow.
So it's super cool test. I know, and they're not that expensive, really. It's they run, depending on what veterinarian you go to, about $350.
But is it covered by insurance by any chance? Do you know?
Some of his tests are, and some of them are not. Ironically, it's funny you said that. I just had a meeting with Trupanion on Friday trying to push for this because it's really a game changer. I got to tell you, why not do a fecal transplant and do ozone and spend a quarter of what you would spend doing intestinal biopsies and trying to get your answers that way when you've got some really good testing here. This lab also tests for cancer. It'll do a cancer panel. It'll determine lymphoma versus irritable bowel syndrome.
Right.
It's really a cool lab. There's so many different tests. They do fur analysis for minerals. They have specialty panels. They do pre-stem cell testing right up your alley, right?
Right.
They'll actually do pre-stem cell testing, allergic dermatitis panels, allergy testing. They actually do glyphosate testing now, looking for Roundup. And the newest one they're doing is this mycotoxin testing in urine, where they're checking for molds, because a lot of people are finding that their animals and themselves are living in houses that are affected with molds. And so this test will actually tell you
Right.
mold testing as well. And then that's the testing part, but the treating part is this laboratory will actually give you a page of what direction to go and how to treat. It's a really nice, it's nice for the veterinarian. It's great for newer veterinarians, especially because it will help guide them as to what direction to go in. And, do you want to use antibiotics? Do you want to use probiotics? Do you want to use supplements? They'll actually give you certain supplements to pick as well. So I really like that. And it will also say on there, a fecal transplant or ozone therapy or, some of the other modalities. It's really nice because it's an integrative laboratory. Let me tell you, that's another reason why I love it. It gives you integrative, meaning Western versus Eastern. They meet
or combined, either or.
Combined, right, for the best treatment possible.
It's always a subtle reminder to myself, even, what we don't generally think is a great example is mold. I'm in the South, so we have humid weather, so there's always mold issues. So you think about humans, but you never really think about your other sentient beings that are living with you, whether your pets. You don't think that. I mean, it shocks me. It's so simple. It makes sense. So your dog or cat may be sick because they're living in the same environment that you're not supposed to be living in as well. So that makes a lot of sense.
Exactly. Yeah, and I've had people come in like that, and a lot of vets poo-poo that. But I mean, mold is a real thing, right? There's a lot of people getting really, really, really sick,
Right.
not even realizing they're living in houses that may have flooded, houses that, are growing mushrooms. I've had somebody with mushrooms growing under their dishwasher. I mean, think about that.
Or whatever,
their carpet. Exactly. So, it's out there, and we just need to bring awareness. I think that's a lot of it. But, you do get a lot of veterinarians that poo-poo a lot of this stuff. You need to find one who doesn't. If you feel in your heart, and I always say, you live with that animal. No one knows that animal better than you.
Right.
So I tell veterinarians, listen to what the pet owner is saying. It's so important, because a lot of times they'll come in, oh yeah, they're just whatever, No, you can't do that. You need to listen to what they're saying, because that's where you're going to figure out where the issue is. Because, I did house calls for a very long time, and now I'm more stationary. But when I went into people's houses, the information I got was huge, right?
I've heard that a lot, actually.
Yeah, it's fabulous. So,
because the environment they're living in, what they'll be eating, you get to see everything right there at that place, which is always really cool.
Yeah.
And we'll be right back. We are supported by PrepVet, providing stem cell therapy for pets.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
So to break down the test to treat thing, basically the way I look at it and this is for the listeners out there without being real technical, basically what this is doing is, one, it's telling you what may be wrong with you. Two, it's recommending antibiotics that would work versus antibiotics that wouldn't work, and just giving you a bunch of different options versus, a typical vet gives you an antibiotic. If they're not testing and they find out your body won't take it, it won't help.
Right.
So that makes all the sense in the world to me.
Right. And, more people will die of antibiotic resistance over the next 5 years than actual infections. So it's our job as veterinarians. AVMA has even put on there, we need to be good antibiotic stewards. We need to be aware of what's going into the animal, not just our pets, but our food animals. Huge, right? Because most meat inspectors are veterinarians. People don't realize that. And, are you inspecting an animal that's been on antibiotics? That's the food chain, folks. It's going right into us. And people don't think about things like that. It's not just our pets that are being affected, it's our food chain as well.
Right. Absolutely. So let's move on because I know we want to get into the ozone. I know we've talked in the past, but I want you to get in to dig a little bit deeper because now you've created these machines that are more designed for animals. What are you doing? How's it working? And for people out there that have an animal that they think maybe it's got some issues, can we just kind of dig into that a little bit?
You bet. And if people, just a real Reader's Digest version of ozone, because I don't know if the listeners are so aware of it. I mean, it is gaining popularity more and more, but ozone is an O3 molecule, right? It's an oxygen three. I guess you can't really call it an oxygen, but just to make it more simple, it's an oxygen or an O3 molecule that's very unstable. So when it hits the air, it breaks apart, or the body or the system, it breaks apart into an O2, which is oxygen, and an O1, which is a free radical. And that free radical is very unstable. And it has a very, very powerful antimicrobial effects. It will latch on to anything like a virus, a bacteria, inflammatory cells, cancer cells, pain cells, and it basically just annihilates them, right? And what are you left with? You're left with oxygen. So it's considered a form of hyperbaric medicine, really.
Sure.
And what is the one thing that we cannot live without? Oxygen.
Oxygen, exactly.
And what is disease? Disease, most of the time, we're deficient in oxygen somewhere. Our body is tanking because we don't have oxygen. So ozone is something that is a natural way to increase oxygenation in the body, and also from a natural standpoint, kill off these negative, viruses, bacteria, and cancer. So it can be utilized in there's at least 40 different applications to ozone. Many people don't know that, but I think the most common way is, I have pet parents that buy our little woofer machine. They bring it home and they can do it on their pet at home. It's very simple. You do need an oxygen source. So that's something that's important, whether you get a prescription, it is a prescription, or you can get an industrial oxygen tank through the welding shops.
Sure.
But, it's people can do it through a rectal catheter. It's a small silicone catheter. You can deliver ozone right rectally to your pet. It goes right into the colon, feeds up into it kills the biofilm or cleans the biofilm of the gut, which is great. It's all the toxins and garbage that's in there. But then it releases this blast of ozone, which breaks down into oxygen, goes straight to the liver and detoxifies the body instantly. It's great.
So, quick question. So, you've got a dog. I mean, I guess they treat cats as well. I can't imagine doing anything with rectal with a cat. But how do you, if you're using a catheter? I mean, it's easy enough to get in. It's like if you've got kids, a rectal thermometer. But if you're doing it, how do you keep them settled, and how long does it take to do something like that?
Well, the catheter is maybe a little bit bigger than a rectal thermometer, so it's not invasive at all. It's pretty small. It's silicone, so it slides in because ozone degrades everything. Silicone's one of the things it does not. We put a little olive oil on the end of it to make it slippery,
Uh-huh.
and then it just slides in a couple inches, and we hook a syringe to the end that has the ozone in it, and we just push it in there. Uh, Depending on the weight and the dose for the animal, because there are different dosages,
Right.
we hold the tail down for about 3 to 5 minutes, and that's it. I mean, it's painless. It's very painless.
So it's fast too.
It's very fast. It's very quick. It takes about less than 30 seconds, really. It's a really
Right.
quick way to get the ozone in. Now, that's probably one of the simplest ways, but there are many other ways to utilize it. One of my favorites, it's a lot more complicated, but really cool, is they call it major autohemotherapy or ultraviolet biophotonic. And it's where we take blood from the animal. And all these therapies are actually quite gentle. They're not hardcore. We're not sitting on catheters for hours in a hospital. We do it. We take a blood sample based on the animal's weight. We infuse that blood sample with ozone saline. We actually can ozonate saline. We use those now as for subcutaneous fluids to hydrate animals, or you can use it to wound flush. But we add that to the blood sample, and then we add a little bit of ozone gas to that, and we give it back to the animal. We can mix it up, give it back to the animal slowly through a butterfly catheter.
Yeah, so you're doing basically a drip. So you're actually oxygenating the saline and doing that. That's interesting. I didn't know they do that.
Yeah. Yep, we oxygenate saline. That's one of the 40 or 50 ways you can deliver ozone.
Right.
Say you have a cat with kidney disease and you want to get subcutaneous fluids into it, you can give ozonated subcutaneous fluids. You've now just increased the oxygenation into the body tenfold, right? Or more than that, even instead of just using straight regular saline, you've put ozone into it, and it's painless, right? It's not going to hurt anything. But this blood, the way we do it with the blood, it acts like an autologous vaccine against their own disease. So cancer patients, autoimmune patients, systemic illness or systemic infections can be treated. And then if you want to bump it up even one more level, we run that sample through a cuvette in an ultraviolet machine, which has wavelength spectrums on it. And each wavelength has a specific activity that kills certain viruses and bacteria. So then we can give that back to the animal. It's very cool. It's a very cool technology. They're doing it in humans. I've actually had the treatment myself, and it's pretty painless.
Yeah. Well, so let's talk a little bit for people out there. I know you talked to a few different disorders. Let's kind of go down the line of why. I mean, ozone is basically oxygenating the red blood cells, correct?
Yes.
Okay, so what would be I mean, other than just from a general health standpoint, what would be some of the main areas that people should really seriously look at as an option, what they may do?
Well, anywhere there's inflammation in the body,
Okay.
there's an increase in carbon dioxide, right? So oxygen and ozone will benefit healing in that location. Autoimmune disease. Ozone helps even with human ailments, muscular dystrophy, for example. They're using it in humans for muscular dystrophy and macular degeneration. You can actually use ozonated saline in the eye, which is really cool. So you're bringing oxygen to your eye. We use that for eye infections. We flush
Huh.
pets' eyes out, on a regular basis if they come in with something in their eye or if they have a corneal scratch. We just use the ozonated saline. Cancer is probably one of the big ones. That's something that cancer doesn't like ozone, and it's used a lot for cancer. Chronic infections like hepatitis, cystitis, or urinary tract infections. Super cool way to use it in urinary tract infections is we get an ultrasound, we look at the bladder, we actually infuse ozone gas into the bladder, and guess what it does? It kills the bacteria in there, right? And the inflammation.
Wow.
Super cool way to treat a urinary tract infection with little to no antibiotics. Now, I'm not saying don't go out and stop using antibiotics, but if you're going to use them, be mindful about it and do your testing to make sure that we're not creating all this resistance. Ozone's great for allergies. I sell an ozone pet bath, right? So you can put your pet in the bathtub and use an ozonated water bath, and you're killing all the bacteria on their skin. It's great for allergies. It's great for those dogs with itchy feet. Sinusitis. I designed a little mask that you could put over the pet's face. We bubble that through oil because we want to make sure ozone can be very toxic if you breathe it in. So you need to be really careful about that. So there's certain things to hook up to the machine. There's a mask that we use through an oil bubbler. Intestinal diseases, irritable bowel disease. That's where that test and treat comes in, right? When we get that result back, right on there, it'll say, ozone, great. You can do rectal ozone or a fecal transplant. I always do my fecal transplants with ozone. It's almost silly not to use ozone when you're doing a fecal transplant.
Right. Sure. At that point.
Yeah, you want to kill that biofilm, right? It's sanitizing the gut, I guess.
What about stomitis?
Absolutely. I was coming down the list. Dental infections. Dental infections, fabulous for dental infections. There's actually ozone dentists out there now.
Oh, really?
Oh yeah, they're local. You can Google them for humans. The ozone dentists have been through volumes of training. There's some fantastic continuing education courses. I did a lecture at one of the human conferences back in November with Margot. Margot Roman, famous Margot Roman. She's one of my partners. We're actually writing a textbook together. It should be out here in the next month or so on ozone therapy, believe it or not. Ear infections. That's one of my favorite ones. It treats these chronic ear infections. I could tell you dozens of stories of patients that have come to me that have been recommended either the ear zap or the ear ablation surgery, where they want to cut the ear canal out because they just can't get the ear infection under control.
Right.
You pump ozone into that ear, I'll tell you what, lickety split.
Really? So are they doing that with younger kids? Because kids get, they get ear infections, and what they do is it's all antibiotics now. But
Yes, they are doing it. It's just a stethoscope application. Doctors are doing it. Sinusitis, people are using it for sinusitis and ear infections. Also, brain. It'll go to the brain as well and oxygenate the brain that way. We use it for arthritis and chronic pain. One of my favorite ways to use it is for intervertebral disc disease. I use it with ozone acupuncture. I actually use the ozone in acupuncture points, potentiates the acupuncture. Wound care is amazing for wound care, flushing wounds, killing the bacteria, creating regrowth. We also make an ozone oil that can be used topically on teeth, believe it or not, for dental disease.
I was going to say like gum disease or something.
Yeah,
like that.
you can do oil pulling, right? If anybody knows what oil pulling is.
Right, yeah.
Bacterial viral infections, Lyme disease in people. I actually am a Lyme disease recipient. Thankfully, I could say I've had ozone and it's really helped quite a bit. Circulation disturbances, Cushing's disease, Addison's disease, diabetes, hyperthyroid. I mean, the list goes on and on, right?
Are they using it for MS, or because a lot of people are doing IR right now? So are they using it for MS or any other neuro disorders?
They are, yes, they are using it for MS as a. Now, bear in mind, I'm not saying this is a cure. I'm saying this is a treatment. It's a treatment,
right?
And hyperbaric medicine is a treatment. That's it goes along with if somebody's getting chemotherapy, it's complementary to that, right? Same with some of these other crazy things like mistletoe, for example. I do mistletoe consultations for those people who don't know what that is. It's a fabulous injection that's done 3 times a week. It's for cancer, right? It's actually for many other things, but and I think before this I talked to you about what's called anthroposophical medicine. It's a hard word to say, but that's mind, body, mind, body, and spirit medicine. It's from German homeopathy. Rudolf Steiner is the gentleman that started, the father of homeopathy, but also discovered this anthroposophical medicine through mistletoe. And I know I'm jumping all over the place, but ozone is complementary to not only Western medicine, but Eastern medicine as well. So it's really nice. It goes along very well with many, many different therapies.
Yeah, well, so one question I had, because you were saying, hyperbaric versus, it is hyperbaric, but when would you do in a hyperbaric chamber versus ozone? Or is this actually eliminating doing hyperbaric chamber, or working in conjunction with that?
I wouldn't say I would eliminate hyperbaric chambers. It is hyperbaric chambers they're hard to find, right?
Right.
There's only a few veterinarians that have them. They're very expensive, and they don't necessarily treat all of these different things. So, for example, like stem cell, right? I've worked with you on some of the stem cell cases.
Right.
I've used it on degenerative myelopathy for some of my stem cell in my cases. And, I had a dog I put into a hyperbaric chamber with DM, degenerative myelopathy. It didn't really do a whole lot, but I'll tell you what it did is injecting ozone into those acupuncture points on the spinal area where that dog was becoming paralyzed really helped a lot. I brought oxygen to those nerves and tissues that were being damaged, and it just prolonged the animal's, demise for becoming paralyzed. Really helped with pain issues. You can use it also. There's something called prolozone, where you can mix ozone with dextrose and procaine and vitamins and give it into joints or around joints. That's what's so cool about ozone is it goes where it needs to go, and it will treat pain and some of these chronic injuries as well in animals.
Well, again, getting back to what you originally said, it's, inflammation. And generally, anytime you feel bad, a lot of it has to do with inflammation for a big part of it. So if you're eliminating the inflammation or I don't know if you're eliminating, but subsiding it at least, it makes a lot of sense. I'm sitting there thinking about, some of the DM treatments that we've done, because we're repairing the cells. But in the meantime, if you're bringing ozone to that, it may be a good partner for it.
Oh, absolutely.
Yeah.
Yes, absolutely. That's what's so nice about ozone is it's really, it's very complementary. I will say this: if your pet is having chemotherapy or radiation, we always tell people to wait a day in between at least.
Right. No, well, that makes sense.
Or IV vitamin C. We do a lot of IV vitamin C treatments at the clinic, but it is complementary with all those. Mistletoe, not so much. You can use it, same day. Hyperthermia, we do hyperthermia treatments, whereas we're heating up the tumors. We can use that kind of like the Santa wave.
Right.
We don't have a Santa wave, but we use hyperthermia in our clinic. But it's just so nice. I mean, it does treats so many conditions. I can't imagine not having it in my clinic anymore. It's become
Right.
an integral everyday part of the clinic. Easy peasy. You have an animal that comes in for vaccines, let's say, and we're not big on over vaccinating. We do a lot of titer testing, but I have clients that want vaccines. So we offer them a dose of rectal ozone afterwards. Why wouldn't you do that? Give them a little blast of some oxygen afterwards, because those vaccines can be hard on pets, right? I mean, people don't realize there's so many different things in a vaccine.
Right.
We want to be mindful about what's in them. Are there antibiotics in them? Are there preservatives in them? I mean,
right.
I think listeners really, really need to investigate what that veterinarian is giving in a vaccine, because some of them are not getting the information they need. You can walk into some of these big chain veterinary clinics and they'll pop 11, 12 vaccines at a time. What a disservice we're doing to the pet.
Right, exactly.
It's too many at one time. Spread them out. If you're a vaccine advocate, spread them out and give your animal's body a chance to recover and recuperate. But the ozone is a nice adjunct to that. It's a nice healer. It helps.
Does it, the adverse reactions you get when you're getting chemotherapy radiation, does the ozone help you dissipate that a little bit because of the inflammation, or is that just going to be part of the poisoning of the system with your chemo stuff?
Oh, no. I think the ozone is great. It's an anti-inflammatory.
Right.
You can drink ozone water. It's very helpful when you drink the water.
Uh-huh.
It gets into your gut. Of course, a fecal transplant going along with chemotherapy is also a great idea, because you're just putting healthy DNA into that that microbiome system of the sick pet. The rectal ozone is great for that. It'll help again with a lot of digestive disturbances come with chemotherapy. Stress, things of that nature. But yeah, absolutely, you can use it alongside with that, and I do think it helps. Now, you can get adverse reactions with ozone. I'm not saying that it's 1,000% safe.
Sure.
But it's pretty darn low. And if you're going to get some type of an adverse reaction, and I've had a couple in my career, 17 years, I can think of two, believe it or not.
What would that be? What would be an adverse reaction to ozone?
I had a horse and here I am saying I don't treat horses, but as a favor to a friend, in equine, it's fabulous, by the way. We inject straight gas into equine. We don't dilute it down. We do not recommend that for the smaller animals. There are some veterinarians that do, but when you take one of the human courses, Frank Schallenberger, who's kind of one of the ozone gods, he's a human doctor who teaches ozone therapy, and he was one of my mentors. You sign a contract that you do not inject straight gas into an animal, and I've abided by that, other than equine, because equine have big giant veins.
Well, they're big, yeah.
They can handle the bubbles, and if you go slow and you know what you're doing, no problem. But this particular patient, I had been filming. I actually wanted to film an instructional video to show veterinarians how to do it, because I get a lot of phone calls. So I thought, what's better than just having a video? And I filmed about 8 hours up at this horse ranch, all kinds of ways to administer ozone. And unfortunately, the person that was filming forgot to turn the sound on.
Oh, wow.
And so 8 hours of filming went in the toilet, and I had to go back the next day. And this horse, who was such a great horse, we did the IV, they call it DIV or direct IV. We did it again to him, and he ended up having what's called a Herkimer reaction or Herkheimer reaction, which is basically a reaction where there's so much antimicrobial die-off in that particular sick animal, they react to it like an anaphylaxis. And this horse got hives and was sweating because he got too much ozone.
Right.
And so we treated him actually naturally with clay and some of the homeopathic remedies for an anaphylactic reaction, bathed him and all that. And he did fine. He was okay after that. We just did too much. We did him 2 days in a row, which we never do, but because we were filming.
Right.
So it was a good learning experience. I actually have it in some of my lectures to show veterinarians
what not to do.
what not to do, right? I think that's huge. Is actually two of my most famous popular lectures are the Herkimer reactions and the troubleshooting in the ozone machine, because
Right.
there's so many moving parts and people get confused. And so we encourage training. Margot and I do trainings here at the clinic for veterinarians. I also can be hired to come into veterinary clinics and teach staff how to use the machine. We actually have them bring true cases, true patients in to teach, and people love it. It's become very popular. We do not have a classroom environment. It is all hands-on when we teach our veterinarians how to do ozone therapy, fecal transplants, IV vitamin C, mistletoe, all those things we're teaching to veterinarians now. And I think the way to get the word out is the pet parent, right? It's like
Right.
CBD, right? CBD is it's illegal in California for us to have CBD, but we can talk about it, we can prescribe it, but it's a federal law. We're deemed by federal law that we can't have it on the premises. But I think consumer demand has created so much pressure that it's they're dropping their hats a little bit and letting us use things like that more and more. And I think these modalities that I've just discussed are becoming more and more popular, and I think consumers are seeing the value in it. They're putting pressure on say the FDA or medical doctors to learn about these things, because they're going to go to veterinarians that do this. They want their animals to live comfortably and beyond what Western medicine can do. And if they don't have the education beyond that, they're going to find people who do, right?
Yeah, and I know a lot of vets that work with somebody that's got a CBD company, and then they get it directly from them. It's generally what they're doing for the
Yes.
most part.
Yep.
Yeah,
Yep. And I mean, CBD is fantastic.
sure.
If you ask me if any of my patients are on phenobarbital or Keppra or any of those drugs, I don't have one in my practice on any of those. They're all on strict diet, herbals, and CBD, and they're not getting seizures and they're doing great. And so there's something to be said for that. When it's
Absolutely.
used correctly and with respect, I think there's nothing wrong with that. It's unfortunate that our federal law is governing us right now, but I think things will change.
Well, they are changing.
Yeah, consumer demand is really what puts pressure on the big guys to make change.
So, as we're running out of time, what have we missed? What else do you want to cover here really shortly so we don't go over time and in that? What do you want to add to everybody that's listening out there?
I think, make informed choices. AHVMA, American Holistic Veterinary Medical Association, is a great place to find a holistic veterinarian. Do your research online. Also, ozone can be used, all these modalities can be used on exotics. I see a lot of exotic animals. I treat all kinds of critters. And so I do a specific lecture on exotic animals and holistic approaches to treating them. And so, the consumer needs to be educated, go out and look for things. Diet is huge. Microbiome is huge. We're learning about that more and more. Fecal transplants, make informed choices about the products you're using. I will say that. I love Margot Roman. Her fecal transplant material is bar none highest quality on the planet.
Right.
So make sure to check don't just read the fine print and say, oh, I'm getting my fecal transplant. It says raw fed. Well, how much raw fed? What are these animals? That's really important, right? Animals that have been housed for years, that have limited vaccines, no antibiotics, not spay or neutered, vaginal birthed. The list goes on. And Margot's animals are just that super quality. So if you're going to do a fecal transplant, question the doctor where they're getting that from. Question the testing they're doing. Ask for these test and treat. Vitamin D, huge. That's one thing I didn't mention. Have your veterinarian check for vitamin D. That's huge. A lot of people don't realize how important vitamin D is, and there's 75% of dogs and cats are deficient in vitamin D, and it can lead to so many diseases, musculoskeletal disease, cancers, autoimmune disease. And it's so simple. It's frightening.
Right.
We want to supplement, but we want to make sure the gut is ready to accept those different nutrients.
Sure.
So the gut needs to be healthy in order to take in these nutrients, and the proper food and diet. That's also species appropriate diet, really important as well.
So, Jyl, if people want to get a hold of you, one, ask about ozone or whatever, or some of these other questions to test, to treat, and that, what's the best way to get a hold of you?
Well, there's a couple different ways. If you want information on ozone, which is, of course, my giant passion, you can go to Regenazone Vet, and I'll spell that for you because it's tricky. It's REGENO, the number 3, ONEVET.com. RegenaZoneVet.com. That's our website. If you want to email me, you can email me at info@regenazonevet.com, and it's spelled the same way. Or you can call my clinic. I have a clinic. It's 916-989-0738, and the gals will be helpful in giving you information on how to reach me, or if you have a veterinarian that's interested in training, things of that nature. Or go to these big websites, ahvma.org, look for holistic veterinarians, or tcvm, that's another one, .com, that's traditional Chinese veterinary medicine. The Qi University also provides listing. So we're out there. There's a lot of holistic vets out there. You just have to find us.
And for everybody listening, it's in the description too of the episode. So let's get to my favorite time. Actually not, but my favorite time for everybody else is to tell the silly animal joke. As everybody knows, we cringe, but luckily today, Jill's got one, not me. So Jill, what's your joke of the day?
Hey, I got one. I got to tell you how I found it. It was on, what's a really great way to wake up every day is just ask Siri to tell you a stupid animal joke.
Oh, great.
And I know it's really funny. I mean, my husband and I were laughing in the bathroom this morning, just listening to stupidity, right? It's so simple, right? We have such stressful lives now. And before I forget to, I forgot to mention my other website. It's www.drjyl.com. It will list all of these different modalities on that website that we offer, but it also educates the pet parent. So you can go onto that website, drjyl.com, and look up. There's a ton of information there for pet parents as well. Let me tell you my joke.
Okay.
I'm not a great joke teller, but I'll try this one.
Better than me.
So this fly says to a human, "Hey, do you have any food?" And the human says, "No." And the fly leaves, right? The fly comes back the next day and he says, "Do you have any food?" The human says, "No." So fly comes back the next day and says, "Do you have any food?" Human says, "I already told you no twice. If you come back and ask me again, I'm going to swat you with a newspaper." So the next day, the fly comes back and says, "Do you have a newspaper? Do you have a newspaper I can borrow?" The human says, "No." Then the fly says, "Then do you have any food?"
It's a good one.
So
It's
stupid, right?
It's so stupid, they're good. That's why I like them so much.
Yeah. So I have one other one.
Okay.
What animal do you not want to play cards with?
Which one?
A cheetah.
I like that one. That one I remember. The other one is too long for me to remember. Anyway, for everybody else that's listening, as I always say, we're always looking for people to tell their joke. So if you've got your grandchild, your own kids, your niece, nephews, cousins, or you want to tell a joke, if you email me at mkyleforrealpodcast.com, I promise you I'll get back to you and you'll be on here and you can tell your friends you're telling jokes on a podcast. Anyways, first off, Jyl, thanks so much for being on. There was so much information there. It's one of those episodes I think people need to listen to a couple times, but I really, really appreciate you taking the time to be on the show.
Absolutely. Happy to help.
Well, thanks so much. And then for everybody else who's out there listening, keep following, tell people about this, ask them to follow. The more people we get, the more cool guests we get like Jyl here. But most importantly, everybody, truly, from the bottom of my heart, thanks so much for listening. For real.
That concludes this episode of For Real with your host, Mark Kyle. For previous and future episodes of For Real, listen via all major podcast streaming sites.